What is procrastination? It is the act of delaying what needs to be done, usually until the last minute. Procrastinators often find other things to keep themselves busy that are irrelevant or unnecessary to avoid tasks that truly require their attention. This may apply to any aspect, such as putting off cleaning one's room, going for a medical checkup, delivering negative news, and most commonly, submitting a job report or academic assignment. There are times when procrastination and perfectionism are related, since there is a psychological belief that it is more acceptable not to do a task than to face the possibility of falling short on the performance. In the Philippine setting, it is more commonly known as the banyana habit or bahala na, wherein they delay the task that should be done. Studies conducted in 2002 concluded that procrastination is most prevalent among college students with an estimate of 80 to 90%. Rabin stated, academic procrastination is the prevalence of a self-perceived problem that reduces academic achievement and increases stress and poor value of life. In line with this, we present this study with the goal to describe the level of procrastination among the Research Methodology 1 students of the College of Rehabilitation Sciences of the University of Santo Tomas. Specifically, we aim to compare the level of procrastination among the different courses of the college. We also aim to describe the relationship of age and procrastination among students. And lastly, we aim to scrutinize the relationship between the level of procrastination and the gender of the CRS students. The study design chosen for this topic is the descriptive, quantitative, observational type. Participants are a sample size of 261 from the Research Methodology 1 students of the College of Rehabilitation Sciences, ranging from the age of 18 to 26 years old. Out of these 261 participants, 97 came from physical therapy, 80 from occupational therapy, 50 from speech-language pathology, and 34 from sports science. Out of the sample size of 261 participants, 27.97% are males with a population of 73, and 72.03% are females with a population of 188. The study was conducted via the university's online course site, E-Learning Access Program, otherwise known as eLeap. The procrastination scale can be self-administered with 20 items that may apply to academic, occupational, and home settings. Participants may answer with extremely uncharacteristic, moderately uncharacteristic, neutral, moderately characteristic, or extremely characteristic. This graph compares the difference of the level of procrastination between the 4 departments of the College of Rehabilitation Science. The average score of each department was gathered and plotted in the data. As seen, sports science students showed the greatest level of procrastination with an average score of 66.71%. Second to them was the occupational therapy students with a score of 65.1%. Speech-language pathology students attained a score of 64.78%, ranking third. And the department with the least level of procrastination was the physical therapy department with a score of 62.46%. This graph shows the relationship of age and level of procrastination among the College of Rehabilitation Science students. The 18-year-old students have an average score of 64.27%, while students aged 19 years old garnered an average of 64.15%. 20-year-old students averaged 64.14%, and the 21-year-old students 63.31%. 22-year-old students have an average of 65.68%, and lastly, the 23-year-old students averaged 63%. This graph shows the relationship of age and level of procrastination among the College of Rehabilitation Science students. Students ranging between 18 to 19 years old have an average score of 64.9%. Students between 20 to 21 years old averaged 63.7%. And lastly, students ranging from 22 to 26 years old garnered an average of 64.5%. There is a 1.4 difference in the average procrastination level between each group, thus showing that male students of the college have a slightly higher level of procrastination as compared to the female students of the college. From the previous data, it can be concluded that sports science students have the highest level of procrastination among the College of Rehabilitation Science students. Occupational therapy students ranked in second, speech-language pathology students third, and physical therapy students having the lowest level of procrastination.